Hi, I'm Tressa Breindel. I'm a functional medicine practitioner and licensed acupuncturist and the founder of InHealth RVA. I'm really excited here to be doing my first webinar with Alistair. Alistair, are you there?
Yes, here I am. My name is Alistair Jones, and I'm an acupuncturist. I've been in practice for 15 years, and recently joined forces working with Tressa. And I've had a long-term obsession with treating heart disease in Chinese medicine. So that's why one of the reasons why I talked with Tressa about putting together this webinar, because it's a really exciting and important topic.
Great, thanks so much, Alistair. Yeah, I'm really excited to be joining with you here today. So this is our first webinar, so hopefully we'll get it off smoothly without any glitches. As Alistair said, we were talking about what we wanted to do for our first webinar. He's had a long-standing passion for understanding and working with cardiovascular disease. And it's been sort of a side project of mine, basically because it's the leading cause of death, not only in the United States, but in the entire world. So where there's a lot of focus on COVID right now, and we were debating whether or not doing a webinar on COVID would make sense, really the most likely cause that any of us will die from is cardiovascular disease. It's a huge burden on our economy. It accounts for almost $500 billion in medical costs a year. And the truth is that we don't really have that advanced treatment for it. It's sophisticated and wonderful as our medical system is, and we'll talk more about this, we don't really have a lot of great options for how to treat it. And we could truly almost bankrupt the healthcare industry if we took a more integrative and functional medicine, Chinese medicine approach to treating cardiovascular disease. So in understanding better how to address cardiovascular disease, functional medicine and Chinese medicine, although the one is technically Western science and the other is Chinese medicine, actually both take a very similar viewpoint. We're looking at what are the underlying drivers that create cardiovascular disease in a person. And I'm going to speak towards the Western biochemistry, physiology viewpoint of things, and Alistair will tell you all about the Chinese medicine. So why do we get cardiovascular disease? Most of us think about, oh, my cholesterol is too high. But as you'll see here, hypercholesterolemia, or high cholesterol, is only one of the things that contributes to the development of cardiovascular disease. The other things that I'm going to talk a lot about are metabolic syndrome, also known as insulin resistance. It's what creates diabetes, oxidative stress, and inflammation. And put together, all of these things develop atherosclerosis. These are plaques that build up on the inside of your arteries. Basically, when you have lipids floating through your arteries, like triglycerides, cholesterol, and they get inflamed and they get a lot of oxidative stress, the body's immune system wants to hide them, get them out of circulation, and it basically jams them into your artery walls and builds up these plaques. These plaques can close off the artery, causing heart attacks. They can break off and then end up downstream in your lungs or your brain, or also your heart, and include the arteries there and create strokes and heart attacks and pulmonary embolism. So the other important thing to understand is that most of these major causes of death in the United States, cardiovascular disease, diabetes, and the ever-increasing Alzheimer's, all have similar underlying drivers, and they have to do with lipid metabolism, metabolic syndrome, oxidative stress, and inflammation. So whereas a lot of us will see that our cardiovascular disease, for example, runs in our family, as it does in my family, that doesn't mean that we are doomed to develop it. Diet and lifestyle plays a massive role in the development of these health conditions, and therefore also gives us a lot of power to be able to prevent them and reverse them. Alistair?
So degradation of the vascular system happens over time. We see the process of plaques beginning to reside in the linings of the blood vessels and years out. And with this buildup, we see both a hardening of the arteries, and we see opportunities for these clots or thromboses to form, be excreted from the tissue into the bloodstream, and create a potential stroke or heart attack. The other thing that happen is that small capillaries will become occluded or stagnant with blood. And we will often see indications of this on the surface of the body. We're talking about here about the presence of spider veins. We don't see those in children. It is a two-dimensional snapshot of what's happening all throughout our body when we have these little capillaries being slowed down and stuck with stagnant blood. So when we see this, we shouldn't just be like, oh, there's a spider vein. We should think, what is happening in my body that it is causing it to degrade faster than it should? From a Chinese medicine perspective, we can also look at underneath the tongue. If we see an engorgement in the vein underneath the tongue, that's another indication like, the blood is too stagnant in this body and is going to create poor distribution of blood and resources to the body because of those small occlusions, and the risk for throwing a piece of plaque or thrombosis is greatly increased. Next.
Okay, so I'm going to talk a bit about what most of us will be more familiar with, the conventional diagnosis and treatment, just so that we have an understanding of what our options are, where there's room for improvement. So most of us will know that if our cholesterol is over 200, our doctor will suggest putting us on statins. But if we dive into the research, the scientific research, which is what functional medicine is built of, we'll see that cholesterol isn't actually the best marker to tell us whether or not we're at risk of developing cardiovascular disease. We want to think more completely about what is driving these atherosclerotic plaque developments. And they are insulin resistance, inflammation, and oxidative stress. So what are these other markers? In functional medicine, what we're famous for is basically doing more advanced and more in general testing to understand what's going on in the body. Every person is sort of my own little research experiment to try and understand what's going on in their biochemistry and physiology. So cholesterol has become a surrogate marker for the development of atherosclerotic plaque. But if you came to a functional medicine practitioner, we'd want to look at other markers to see if you truly are at risk. So we'd want to look at your total cholesterol ratio to your HDL. That's the high density lipoprotein. We want that under 3.5. HDL, the higher it is, it's actually protective against cardiovascular disease. So for example, if you had a cholesterol that was 220, but an HDL that was 84, I would think about your risk for cardiovascular disease a lot differently than someone whose cholesterol was 210, but their HDL was 32. That would be less optimal. LDL, the low density lipoproteins, these are, the higher they are, the higher your risk for cardiovascular disease. The gold standards for seeing if you are developing cardiovascular disease is the carotid intima media thickness test, CIMT. And basically all that is a simple ultrasound in the carotid artery of your neck to see if there is occlusion there, to see if there's atherosclerotic plaque development. And the calcium score is similar. There's also a bunch of these other ones, the Berkeley Heart Lab test or the NMR lipoprofile that looks at a bunch of different oxidative particles. The more oxidative particles you have, the more likely your cardiovascular disease risk. And of course, blood pressure and insulin resistance. So if you have, reasonable cholesterol numbers, but you have very high blood pressure and insulin resistance or diabetes, I'm going to think much more significantly of that you have cardiovascular disease risk. Some people have read about ApoE genotypes. The 3-3 or 3-2, anything in the 2s or 3s are considered normal risk. If you have a 4 or a 4-4, that's a lot higher risk for cardiovascular disease. These are the people who actually do need to avoid saturated fats and cholesterol. The 2s and the 3s, they tend to do well on a nutrient-dense plant-based diet, but can still eat a fair amount of animal fats. Lipoproteins, you'll see those checked fairly frequently, the very low density lipoproteins, making sure that those are not very high. And then also, very importantly and less well known, thyroid function. So when your thyroid is low or hypofunctioning or you're hypothyroid, you'll see cholesterol numbers increase significantly. Actually, back in the day, they used to treat cholesterol by giving people thyroid medication. It would drop their cholesterol numbers, but of course, it would also make them very sick because they'd end up hyperthyroid. But so if your thyroid function is low, we want to optimize that as part of your cardiovascular health. So then what do we do about it in conventional practice? The first go-to is to put someone on statins. Generally, if your cholesterol is over 200, they don't even look at anything else. They just put you on statins. Now, and then they wait for the disease to progress. As the disease progresses, they use these other medications to basically help blood flow through your arteries better so things don't get occluded. ACE inhibitors, beta blockers, diuretics, and digoxin. But it is mostly a game of wait for the disease to develop and then use pharmaceuticals to kind of basically keep you going, keep you alive. There isn't much thought about reversal or about the underlying drivers of these processes. And then eventually, if the disease continues to progress, you'll end up with stents and surgeries for bypass or valve replacement, pacemakers, or at the end game, even a heart transplant.
So Tressa just laid out some of the conventional medical treatments to address high blood pressure and other factors that can affect cardiovascular disease. And some of these treatments work better than others, but the reality is we are losing the war on cardiovascular disease. It's the #1 killer in the United States, and the United States is 28th in the world in longevity. And we're investing billions of dollars in therapies that are only mildly effective. So what I mean by this is, let's look at some examples of conventional treatments and how we should actually understand their real effectiveness. So the most important number, in my opinion, that we should all be conscious of is what's called the number needed to treat. And the number needed to treat refers to how many people need to be treated in order to prevent somebody from dying. And this is where the rubber meets the road. So if we talk about the NNT for a really effective drug, something like Cipro, in a hospital, if you have an infection, the NNT for Cipro is 1.2. That means for every person treated, it will save 1.2 lives. Very powerful. Now, I want to use a fictitious example here to sort of dig into some of the data around statistics that are used to quote unquote inform us about the efficacy of preventive pharmaceutical treatments. Not just pharmaceutical, also surgical. So I have an example here in the upper right. This is taken from the website thennt.com, which I'll talk about in a second. But looking at this graph up on the right, this is an example of a trial where, say it's a 5-year trial, and over that 5 years, there's a placebo there on the left side. So 10 people died over the course of 5 years. Those people got the placebo or did not receive any sort of intervention. And then we look at a fictitious drug called Stop Attack. Stop Attack, the people who took that intervention, only 8 people died. So we see there is what could be called a 20% reduction in death. Now, that sounds a little bit compelling if we think about, wow, if I take this drug, I could reduce my risk of death by 20%. The problem is, if we go down to the image below, we're not talking about all the people who didn't die. That's 90% of the people did not die in the study. So when we're looking at what is the NNT, how many people do we need to give this drug to save somebody's life, we see that it's actually only 2%. And so the NNT is 50. 50 people have to be treated in order to save one person. And that is just not that compelling. So if we go on to the next slide, here we're talking about real drugs that are used to, quote unquote, protect us from coronary heart disease. Now, the #1 drug in America is for statin drug, which is lowering your cholesterol, is Lipitor. Right now, it's prescribed to 26 million people, and it's advertised as reducing your risk of death by 36%. But when you actually look at the numbers, the NNT for Lipitor is, for somebody who has never had a coronary event, is 100. That means for every 100 people who take it, it will save one life. And the improvement between the taking the drug and not taking the drug, you can say, oh, it's 36%. That's because in one study, 3 people died who were in the placebo, and only 2 people died who were taking Lipitor. So this is not a very compelling reality. Now, here's the thing about the NNT, and we're not just talking about statins here. The amazing thing, there's this website, and this is founded by a group of doctors. Next slide. Group of doctors who said, we want to get the most comprehensive data and make it available and make that readily accessible to the public so they can see what is the efficacy of these different treatments. So this website, thennt.com, is a fascinating thing that I encourage you all to explore. Why? Because it looks at all these different therapies across multiple disciplines, 14 different disciplines, and you can look at almost any condition and say, what is the actual effectiveness of this intervention? There's some, we can look at surgical interventions. We can look at pharmaceutical interventions. And with this knowledge, we can make a more informed decision about whether we just want to go down a conventional route or we want to dig deeper to try to get something that's going to create a more significant effect. So if we look at I already mentioned the NNT for a statin is around 100. If you've had a heart attack already, so you've already had a coronary event, a stroke or heart attack, that goes down to 43. So at that point, if you've had a heart attack and you take a statin, you are reducing your risk now so that if you take the statin, 43 people take it, you will save one life. It's a little more reasonable, but it's not that great. If we go to the NNT.com, we can see all sorts of interesting things, like if you just switch to a Mediterranean diet, which we know is really basic. It's more vegetables, lean meats, salads, and low fat in general. The NNT for that is 63. Just that is more effective than any statin. So I encourage you to go to this website and just explore some of the things out there. There's some real surprises. Next slide. So when we talk about statins, this study in JAMA, the Journal of American Medical Association, showed that looking at 65,000 people who were at risk for high risk for coronary heart disease who took statins, there was no meaningful increase in extending their life. But at the same time, 10% of the people who took it would suffer permanent muscle damage. These are the people who take statins and then they have achiness in their legs. They don't move as well. You can also see in the data that those people who are taking statins tend to move a couple hours less a week than people who are not. Also, 2% of the people who take a statin will develop diabetes statistically. Next. So why do medical doctors treat this way? Well, they kind of have to on some level. there are a lot of people who are not very interested in doing the work to actually reverse disease processes in the body. It takes work. It takes real lifestyle changes. It takes support. It takes time on the part of the practitioner. And most medical doctors are not trained in this way. They are really on the front lines trying to support so many people who have serious, complicated, yeah, next slide's good, serious complications that are threatening their long-term longevity. And basically, pharmaceutical interventions are a way of hedging the bet a little bit to slightly reduce the risk of death. And so people who smoke, people who are obese, people who have diabetes, people who have really high cholesterol, people who have really high blood pressure, it makes sense to give them, hedge the bet a little bit if we can make a little change. But if you actually want to reverse your risk, lower your risk of dying of heart disease, you have to do a lot more. There's just no other way or shortcut around it. Next.
Okay, so thanks so much, Alistair. So I'm going to basically now dive into what you can do. What's the work if you're willing to do something else and you want more options than just to take statins and wait for the disease development to develop. Alistair and I are going to tell you about what you can do. So a little bit about the difference between conventional medical practice and functional medicine practice. For the biggest example I can give is if you have 10 different people with cardiovascular in the room, you're going to have different underlying reasons how they ended up with cardiovascular disease. And the difference between the functional medicine approach is we really try to understand what are these different reasons that they got to where they are, and therefore create personalized medical programs to reverse that, to treat that. So for example, what is one person's cardiovascular disease might be another person's insulin resistance, smoking, and stress. In conventional medicine, we look at this because basically diagnoses are not diagnostic, they're descriptive. Cardiovascular disease, it doesn't really tell you how you got there. Arthritis, joint inflammation, again, doesn't tell you how you got there. IBS, kind of anything with the word syndrome, irritable bowel syndrome, so anything with the word syndrome tends to be sort of a catch-all for the conditions that have many, many different causes. So in functional medicine, we really understand that many different diagnoses like diabetes, cardiovascular disease, Alzheimer's, all have these similar underlying driving mechanisms. And as I've said before, they tend to be lipid metabolism dysregulation, insulin resistance, oxidative stress, and inflammation. And then vice versa. People with the same diagnoses may have different underlying causes. So we get all those people in the room with cardiovascular disease. If we have a woman in her 50s, postmenopausal, never had a heart attack or a coronary event of any kind, not necessarily overweight or a smoker, she has cardiovascular disease. If her lipids are, let's say, they're close to 300, that's a much different disease. It's a much different condition than a man in his 60s who's had a heart attack, who maybe is overweight and has several drinks a day. These are different conditions. We need to look at them differently in order to better treat them. So we're not looking at one cause creates cardiovascular disease, high cholesterol. We're looking at the many different paths that can lead to the development of atherosclerotic plaques and the development of cardiovascular disease. Another major difference is in conventional medicine, it tends to be rather disease focused. I'll wait for you to have cholesterol over 200, give you a medication for it, wait for the disease to progress, only treat or diagnose once the disease is established. As Alistair mentioned, Chinese medicine and functional medicine share a similar methodology that we try to prevent conditions from happening. And we try to, and then we also want to focus on what actually makes you feel well. A popular saying is to focus on thriving, not just surviving. You don't want to just not die of a heart attack. You want to feel well. You want to feel well into your 60s, play with your grandchildren. You want to not develop disease. You want to have energy and be able to get around well. So we're not just going to keep you not dead. We want you to feel good. And again, in functional medicine, we also will use pharmaceuticals and surgery. We don't throw the baby out with the bathwater, but we give you a lot more options. And looking at personalized medicine and the underlying drivers of these diseases, we're going to foundationally focus on diet and lifestyle. We're then going to use functional medicine, advanced laboratory diagnostics to figure out what specifically is going on with you that's contributing to your health issues. And then we're going to layer protocols on top of that, whether they're supplements, pharmaceuticals, or more. So this is a really popular metaphor for functional medicine. These root causes, this is just a handful of them, all contribute to the diseases listed on top. And another thing in conventional medicine is you'll see a different medical doctor for each of these diseases, even though when we really understand the science behind them, they all are driven by common underlying causes. So in functional medicine, we of course want to know disease diagnosis, but it's a little bit less important because, for example, if you have heart disease and you have diabetes, the treatment program is actually very, very much the same. We're going to focus on diet and lifestyle. We're going to look at your gut microbiome, your hormones, your nutrients, inflammation, and oxidative stress. And I'll dive more into that in a little bit. So this is a really good statement that embodies functional medicine and Chinese medicine from the World Health Organization. Health is not just the absence of disease, but it's a state of optimal well-being. I get told by all my business coaches to stop using the word optimize because it's one of my favorite words. But basically what we want to do is to optimize your system. I'm not worried about so much losing weight or, getting really ripped or looking a certain way. What I want to do is, like an engineer, is get into your systems, figure out what might not be working to the best of its ability, and to really optimize that. So here's what the different paths for cardiovascular disease would look like in a conventional medical practice versus a functional. So let's say you walk into your doctor's office for your annual, you're 53, your cholesterol is now at 224. He says you're going to get a statin. And then what do you do next? You wait for the disease to develop. Most doctors, unfortunately, are not given the tools to give you education on nutrition, exercise, supplements, nor are they given you the time that they would need to even give you that information and to do the health coaching you need to make that successful. So that's kind of the sum of cardiovascular disease interventions. Cholesterol over 200, statins, wait for your blood pressure to go up, put you on a blood pressure medication, wait for you to have a heart attack, and so forth, baby aspirin. In a functional medicine approach, ideally, we'd probably see you're a bit younger. We'd take a medical history, lifestyle history, body systems review, and look at your family history to try and assess which health issues we might want to be concerned that you could develop. You wouldn't just look at your cholesterol, LDL and HDL. I like to run, it's called an NMR lipoprofile. Again, it looks at a lot of different types of particles and how oxidized they are to give a better reflection of your risk for cardiovascular development. We look at multiple different possible sources of inflammation. A big one that we talk about a lot in functional medicine is the gut microbiome. If you haven't heard about that, the gut microbiome is where 75% of the entire immune system of the body lives. So it's kind of a no-brainer that we'd want to get your gut microbiome nice and healthy, and then the food that you put into your gut would want to be nice and healthy to help control inflammation. Absolutely no-brainer, insulin resistance. A major driver of cardiovascular disease and vice versa. Diabetes and heart disease are basically same conditions, just manifesting in different parts of the body. And then, of course, your family and personal history. So in my family, cardiovascular disease is pretty rampant on my mother's side, diabetes more so on my father's side. So my risks are a lot different than someone who didn't have that going on. And then I'll get into our different treatment approaches. So foundationally, the first thing you can do before you even see a functional medicine practitioner, although some people would want a functional medicine practitioner or a health coach to help them with this, is lifestyle therapy. All the wonderful, fancy, advanced functional medicine testing that I love to do and digging into the data won't be able to be absorbed. It won't have the impact if you aren't already doing a lifestyle therapy. Of course, that's nutrition. People always want, it's such a simple answer as far as what to eat and what your nutritional strategy should be. But then because we're humans and food is about so much more than nutrition and staying healthy, it becomes more complicated. But I like Michael Pollan, the famous food writer's saying, eat real food, mostly plants. Try to think unprocessed. Processed food didn't exist before the 1940s. We used to go to the farmer's market or the farm, get our vegetables, get our meats from the local butcher or hunter. Try to think unprocessed, and don't just think about what not to eat, but think about what to eat more of. And that's usually anything in the plants family, vegetables. Exercise. Nutrition is foundational, but exercise is almost as important. You can reverse cardiovascular disease, high blood pressure, diabetes with exercise. It's one of the keys to longevity. Look at someone who's a lifelong exerciser. They'll look 10, 20 years younger in their 60s and 70s than someone who is sedentary. Especially as we get older, it's really, really important to maintain our muscles and our balance and our structure. If we don't use it, we'll lose it. It's not like when we were 25 and we could sit around and then jump up and go play a game of something. So stay active. It will be one of the major cures for cardiovascular disease. So most people are pretty good at focusing on those two if they're health conscious. The next two sometimes takes some reminding. So sleep. Most people need 7 to 8 hours of sleep, and that is most people. There are very few people who can get away with less than that. The joke I make is you're probably statistically not one of them. One of the simplest things you can do for energy, mental well-being, clarity, mood is to get enough sleep. If you're getting 7, go for 8. Make sure that it's deep. There's a lot of devices on the market these days that help you track how deep your sleep is, how good your sleep is. Excuse me. You can use those if you're waking up after 8 hours of sleep and still not feeling refreshed. Excuse me. And then the other thing to remember, great nutrition, getting plenty of exercise, getting 8 hours of sleep. What's your anxiety like? What's your stress level like? How much are you taking on in your life? Alistair is going to talk about this a little bit more. Chinese medicine talks a lot about the connection of emotions in the mind and the body. But stress, anxiety, lack of human connection, these are all major statistically correlated issues with development of heart disease. Mindfulness-based programs, meditation, counseling, time with community, building community and connection are very important for the prevention. So once those things, excuse me, are laid into place, then all of our great functional medicine work can have a lot bigger impact. So we'll test to see if you have any of these issues, and then we'll use protocols to ameliorate them or optimize them. If after nutrition and exercise and sleep, you're still not insulin sensitive, we can use things like intermittent fasting, ketogenic diet, supplements like alpha-lipoic acid, forskolin, berberine, in order to help improve your insulin sensitivity. Lowering inflammation. This is a picture of the gut microbiome, or at least a cartoon picture of the 100 trillion organisms, mostly bacteria, that live inside your gut microbiome. The gut microbiome is always the place we start with when we're thinking about inflammation, since, as I said, 75% of your immune system's there, but we can look elsewhere as well. Your thyroid, adrenal, and sex hormones, especially if you've had a lot of stress, after andropause, which is male menopause or menopause, these things being dysregulated can contribute to inflammation and lipid dysregulation and insulin insensitivity in your body. And they can make a world of difference in the reversal, prevention, and treatment of cardiovascular disease. So I've harped on enough about the healthy gut microbiome. Certainly the foundation of that is your diet, lots of plants, not sugar, not flours. Get the processed stuff out, eat more of the stuff that's coming straight from dirt, plants. That being said, that won't necessarily completely treat the gut microbiome. If you have overgrowth of bacteria or yeast or insufficiency of the good probiotics or number or poor digestion, improving that will help reduce inflammation and nutrient absorption throughout your body. And then nutrients. So we like to layer this on top. And I use testing to decide what nutrients you use. if you go online, you could read about any nutrient and decide that it's something that makes sense to take. I like to personalize this with personalized testing to find out which nutrients make sense for you, that your body is lacking and needs. And then actually on top of that, once we've gotten sufficiency of nutrients, then we can think about using nutrients on top of that. For example, if you've done all of the lifestyle and functional medicine work that we can do in order to optimize your cardiovascular disease risk, and you still are showing risk factors, we can then use nutraceuticals, herbs, supplements to reduce that risk before we may have to go to statins. So that's the process we would go through. Diet and lifestyle, the functional medicine process, supplements on top of that that might help reverse or prevent or treat cardiovascular disease markers. And if we still are showing that you have risk of cardiovascular disease, then we'll go to statins. And the last one, this is a little known one. It's not terribly common, but it's more common than is aware of. Hemochromatosis is a genetic condition. It's usually not diagnosed until it's very, very severe in conventional practice. But subclinical or kind of a lesser version of hemochromatosis, which is iron overload. Genetically, you aren't able to metabolize iron and clear it and put it in the right places in your body. And you can end up with a high ferritin, Ferritin. And that can be driven by a few things. But hemochromatosis, mild forms of it that would never be caught in a conventional practice, can drive insulin dysregulation and cardiovascular disease. So if someone is coming in for cardiovascular disease, I always make sure and check their ferritin. So as I said, we'll do all of the diet and lifestyle work, and then we will do the functional medicine process. And then on top of it, these are some things, some nutraceuticals we can use, almost like you would use pharmaceuticals, basically just to try and move the marker. I don't like the idea, like often people, when they think they're looking for integrative or functional or holistic medicine, they're like, well, what's a pill I can take for cardiovascular or diabetes instead of taking the medication? It doesn't really work that way. Health does not come in pills. We want to fix the underlying, we want to optimize the underlying biology. And then, of course, there's just some things you can't reverse. And then we will use supplements and nutraceuticals to try and do what we can't do through the lab work and the lifestyle work. So, aspirin, forskolin, Gymnema sylvestra, alpha-lipoic acid, magnesium, and fiber. All of these things can help restore insulin sensitivity. Not if you're eating Dunkin' Donuts every day, but if you've done all the work and you can drop your hemoglobin A1C another couple times to the point, these can make a huge difference. Some other ones that to keep in mind. If you are on a statin, you absolutely should be taking coenzyme Q10, also called ubiquinone or ubiquinol. You might see it as that. It can help prevent or reduce the myalgia, the muscle aches you get from statins. It alone by itself shows much improved reduction of cardiovascular disease, even without statins. Red yeast extract is actually a natural statin. It can work for some people, and also for some people can have the same negative side effects of the muscle aches. Omega-3 brings up the good HDLs, can lower lipids overall, and can lower inflammation that contributes to cardiovascular disease. Polyphenols, pterostilbene, flavonoids, these are the nutrients that people talk about in wine and chocolate and berries that are very good for you. I like to prefer to either take them as supplements or to really get them from the vegetables, the fruit themselves. Certainly there's a lot of other things that come with wine and tons of chocolate that aren't necessarily good for you, but in moderation, some good red wine and a little bit of chocolate certainly can be very heart healthy. Pantethine, again, raises HDL, actually improves CoQ10 levels. Artichoke leaf lowers lipids. It has powerful antioxidant, one of the main drivers of cardiovascular disease. And then vitamin D and A, they really support the immune system, which is one of the drivers. Inflammation that can happen from the immune system can drive cardiovascular disease. And then vitamin E, this is a little bit of a controversial one. There's research that shows that actually taking supplemental vitamin E could actually be bad for you. And so I prefer to optimize vitamin E through the diet, more from like wheat germ or organ meats. And then magnesium relaxes the blood vessels and is a nutrient that is needed in most of the chemical reactions in the body to make them happen properly. So again, lifestyle, diet, nutrition is first. Then we look at the functional medicine testing to see what are your areas that need improvement. The gut microbiome, nutrients, hormones, insulin sensitivity, inflammation. And from there, we can layer on top these nutraceuticals to fine tune things. All right, Alistair, thanks.
So I want to give a little background in Chinese medicine, because it's such a unique tradition that we have on the planet. There's nothing remotely similar. So acupuncture has been around for over 3,500 years, and Chinese medicine represents a 2,500-year continuous written tradition. And fundamentally, Chinese medicine is a medicine which focuses on longevity. So what I mean by that is that if we look at the Chinese have a 2,500-year continuous written tradition. They also kept really good records. We know that 1,500 years ago, there were royal courts where the average life expectancy was 60. Nowhere else in the world was life expectancy like this then. This is the reason there are so many people in China. Originally, this was not the medicine of the people. This was the medicine of the emperor and warlords. They were the ones who put the pressure on physicians to keep them strong and virile. They were the ones who wanted to lead troops into battle in their 90s. They wanted court physicians to keep them healthy, and there was a lot of pressure to do so. Chinese medicine is an ancient tradition, grounded in the past, but not limited to it. Next slide. There are 5 main branches of Chinese medicine. We have acupuncture, Chinese herbs, Tai Chi and movement arts, dietetics, food therapy, and Tui Na, which is Chinese orthopedic massage. That said, when we think about Chinese medicine, it's a live tradition. It's not just something ancient. And it continues to grow. For example, in the 1950s, there was a young French idealistic doctor, Dr. Paul Nouget, who was doing some pro bono work with migrant farm workers. And he went down to offer his medical services, and there was a group of Roma gypsies who come through to work the harvest. He examined somebody's ear, and what he found was there's a spot in the ear cauterized, burnt. And he said, what's that? He said, oh, that's for low back pain. Dr. Nouget didn't think anything of it. He goes on, examines the next guy, same spot cauterized, and the next spot and the next spot. So he's curious about this. He goes into his clinic on Monday morning, and he had a client come in complaining, oh, Dr. Nouget, my back hurts. Dr. Nouget, he took a needle and said, put it in that spot where they had cauterized it. The guy stands up and says, oh, that's so much better. He couldn't believe it. So he asked the question, there's a spot on the ear that helps the low back. So the question is, are there other spots that can help other things? And so he began to experiment, and what he figured out is there's an image of the whole body on the ear. And so in 1956, he wrote a book about this called Auricular Acupuncture. And when the Chinese read about this, they said, wait a minute, that's Chinese medicine. And with that, we have a whole new branch of acupuncture that evolved. In the 60s, the Chinese invested tens of millions of dollars in research, and they came up with their own image of the person on the ear. And one of the things that they zeroed in on was the discovery of the line of coronary heart disease. Next. You see this line here. These are all very distinct late-stage elderly people with this line. But as you look around, you will see it on people who are younger. So the line in this picture was discovered by Dr. Li Chun Huang, who happens to be my auricular acupuncture mentor. There are 2 different studies in the New England Journal of Medicine which showed that diagnostically, the presence of a crease in the ear is more indicative of the likelihood of someone having a coronary event than either high cholesterol or high blood pressure. So when I see people who come in, they say, oh, I'm anxious, and I take their pulse and I say, I bet you don't sleep very well. And they're like, yes. And I look at their ear and I say, you're halfway to a full line of developing the line of coronary heart disease. This is another tool that we can use to say, hey, we need to look at the bigger picture here. And this is important because when we frame heart disease from a Chinese medicine perspective, what we're really talking about is the presence of anxiety, the presence of insomnia, hormonal imbalances, panic attacks, inability to focus, cardiac arrhythmias. These are all early signs of future coronary problems. I think that the most ridiculous diagnosis ever developed was the diagnosis, you have a benign arrhythmia. That's to say, oh, sometimes my heart flutters. And in a Western medical setting, they don't want to do anything about it because their first line of to deploy is using a beta blocker, which will regulate the heart rate, but slow your heart rate down. So they just say, oh, don't worry about it. It's just a benign arrhythmia. That is patently unreasonable and absurd. The heart has one job, boom, boom, boom. It should beat regularly. If it is not beating regularly, this is the foundation for future big problems. That's what we know from looking at public health, and that's what we know from looking at the history of treating the heart within Chinese medicine. Next slide. So when we talk about Chinese medicine, we have to have a conversation about the pulse. So in Western medicine, the pulse is a vital sign that is only diagnostically interesting or relevant if the speed is really slow or fast, or if there are skips of beats. Chinese pulse diagnosis is different. It provides an immediate snapshot into the balance of the internal organs. Each wrist has 3 different positions, and there are different organs associated with each position. So we look at the pulse qualities, we look at the rate, but also the strength, the amplitude of the wave that is going through the artery. We look at the depths of the different organs, and as the body changes, the pulse changes. Typically, when someone sits down and allows me to take their pulse, I can assess the state of their immune system, whether they have allergies present. We can learn about whether their digestive tract is functioning correctly, or whether they had acid reflux recently. I can also see if they have neck or shoulder issues, hip problems, back problems. Most importantly, we can learn a lot about the heart in a very short order. I can know right away if a person is anxious, if they're having trouble sleeping. I can differentiate whether they have hormonal imbalances aggravating their sleep at night, or whether it's more likely due to insufficient red blood cells. Is there fluid around the heart? Is there heat from the liver that is liver or stomach aggravating the heart? Why does this matter? It matters because it allows us to see at any moment what is out of balance in the system and how, and what is most out of balance. What is most out of balance is going to be the thing that holds a pathology in place. Both Tressa and I have had a lot of experience dealing with multiple roots holding disease in place. When we address what is most seriously out of balance, whether it's through acupuncture, dietary changes, nutritional supplementation, or custom herbal formulations, it will affect the system. Symptoms will change, and so will the pulse. As this happens, the treatment continues to change with the body. And that is what it takes to reverse embedded processes of disease. Pulse diagnosis is one of the most powerful tools we have that allows us to pivot and change the approach dynamically as the body changes. So initially what this looks like is we're making custom medicine for people on a weekly basis so that we can train the body to get better in a way that we can actually test. Symptoms have to improve and the pulse has to improve. If we're not making progress, then we change the formulation. And this keeps us both honest to make sure that we're creating results, and it helps us maintain momentum because we're not wasting any time going down an avenue that's not being effective. Next slide. So I know that I want to respect people's time here. I know we're getting kind of close to the end, and we were supposed to be done at 1 o'clock. I'm quite willing to talk a little more about acupuncture, but I'm also would like to right now open up the field to see if there are any questions for either Tressa or I, because we really do want to answer any questions that we can for you.
That's great. Yeah, you know, I think this topic is big enough that you could each do a couple more presentations on it. So thanks for acknowledging that and ceding to some questions there, Alistair. So we have gotten a few questions. I would reach out to everybody and just say, if you have additional questions, now's a great time to add them. We'll try to summarize and answer as many of those in the 5 minutes we have left here. So if you look on the right-hand side of your control panel there is a questions area, and you can send those directly to us, and I'll ask the panelists here. Tressa, while we're getting a couple more of those questions in, do you want to speak briefly to how new patients would engage with InHealth and how you all work?
Yeah, thanks, Derek. Thanks, Alistair. So Alistair and I just recently joined forces. We're both at InHealth RBA. So you can actually just find us online at inhealthrba.com. Both Alistair and I offer initial consults to just determine, both for you and for us, if you're right for us to work together. From there, we'll go into the full appointment after the initial consults, where you get the full analysis, and kind of both of us will give you the master plan of what we predict of how you will end up working with us in order to get the best results. So you can find us again online at inhealthrba.com. The front desk number is 804-288-1111, or you can talk to Kate through email at info@inhealthrba. Kate is our amazing guru who runs the front desk in practice for us.
Yes, and also at the end of today's session, you will get a really brief 3-question survey. One of those questions is if you would like to have someone from InHealth RBA reach out to you. So if you do, just enter your contact information in that comments window, and we'll make sure someone reaches out.
Great, thank you.
Yeah, so let's go to a couple of questions. Try to summarize here so we can kind of get to the kind of the biggest number of answers, but we had a couple of questions in and around statins specifically, and how and should I get off of statins, and what can I do to do that? What does that process look like once they come into the office and speak with you? What are those next steps towards moving towards a cessation of the statin medications?
If it's okay, I'll start, and you can
go for it. Yeah.
So for me, I don't recommend anyone go off of anything. So one of the descriptions that I say is we want to keep the scaffolding in place, especially before anybody, Alistair has had a chance to analyze what's going on with you. So if your house needs some repairs, you put the scaffolding on, keep it there until you get the house put back together. It would be, medical malpractice for us to basically say go off your statins. So don't do anything drastic. That being said, the thing you can do yourself at home right now is to think about a Mediterranean diet. More plants, no sugar, no flours. Get some exercise. What I like to think about instead of exercise is just, first of all, assess how many steps you're taking a day, step count of some sort. Start to increase that. Humans were meant to move. My ancestors, your ancestors, I was not descended from Queens. We were moving a lot. We were hauling stuff. We were working. So moving, diet, those are the first things that you can do today. And then Alistair and I can help guide you the rest of the way. Do you have anything you want to say to that, Alistair?
Yeah, it's so often people come in and they're like, I want to get off of this, or I want to get off of that. And I want to be really clear. First of all, I love Western medicine. Western medicine is absolutely extraordinary, and it excels at the acute. It's really good if you are in an accident. And it is not as good often at dealing with chronic health conditions. But oftentimes people come in and they want to get off their statin, or they want to get off their blood thinner. And what we really want to see before we start working in concert with somebody's physician is we want to see real objective increases in function, so we know that they're actually doing better and we're not recklessly just doing something because medicine's bad. No, we want to create meaningful results so that people feel better and they have that improvement in function can be documented both through the pulse and through lab work.
That's great. Yeah.
Yeah, and just a little time check here. It is 1:59. I'm pretty sure that both Tressa and Alistair are available to continue to answer a couple more questions. We've got a couple here queued up. But I did want to let folks know if they do need to hop off to something else, we will be sending out an email, and we can include a link to the video. So if you mention that in the survey at the end, we'll be certain to send you one of those as well. A couple of other questions that have come in that this one's a great one. Does the treatment you provide work with people who have multiple issues? How do you deal when somebody is balancing, dealing with high blood pressure, pre-diabetic, maybe a cancer diagnosis? How does integrated medicine deal with somebody with a sort of a complex array of issues like that?
Yeah, I guess I'll start first and then I'll start. So that's actually the most people. Most people don't have just one of those diseases. So that is absolutely almost the norm. And as I was talking about before, the underlying drivers for the ones that you mentioned, diabetes, cardiovascular disease, are very much the same. So in working on diabetes, we'll be working on cardiovascular disease. On working on both of those, we'll be working on improving your hormones. The body is not a set of isolated systems. If we're going to work on your heart health, we also have to make sure your hormones are optimized, your gut is optimized. Whether you have diabetes or multiple sclerosis or some other autoimmune disorder, fatigue or menopause, we're going to be looking at the underlying drivers. And again, gut microbiome, hormones, nutrients, inflammation, stress, detoxification. We'll be looking at these areas regardless. Cancer is a little bit more complicated one. I'm sure Alistair, we could do 100 years more talks on that, but I would say that most people, there isn't a lot of great understanding about cancer development, but again, we'll want to optimize inflammation and detoxification and antioxidant status. So dealing with multiple conditions in one person we can't work any other way, to be honest with you. So
that's right. And what I would say to that is, first of all, when somebody comes in to see me, I don't ask them what's going on with them. First thing I do is I take their pulse and I talk about all of the imbalances that show up, what I see, without asking them any questions. And that's because I want to focus. They may come in because their back hurts, but I'm going to say, why aren't you sleeping? Like, what's going on? How come you have allergies all the time? And what I think the real strength of functional medicine and Chinese medicine both are, we are always going to treat as much as we can simultaneously. Our training resides in understanding the order of operations. We often can't treat something that people want treated right now until we address other issues. And it's really about mapping out a plan that addresses the fundamental imbalance that is showing up in all these different symptoms. That's what we are always trying to do. We're never just trying to isolate and treat one thing, because that is not how we create long-term clinical success. So I would just say we want to treat multiple issues because we are not issues. We all want a high quality of life, and in order to have a high quality of life, we need all of our systems improving, not degrading faster.
That's great. Yeah, and one other kind of summarizing a couple couple of questions here, but it's more around the process of deepening the answer to how do we work within health. Folks are asking about how will you work with my doctors? Obviously, many of us also have a family practice doc or something like that that we go to, and also how often do we meet with the practitioners here in health once we engage and start to work with you all?
Yeah, so we're absolutely designed to work together. One of the things, it's not necessarily technical functional medicine training, but that I specialize in is integrating everyone's doctors and care plans together, both for your sake, but also just to help you make informed decisions, to help you understand the data and information that everyone's giving you, as well as the latest research. So this isn't in place of your primary care doctor or cardiologist. I will take everyone's professional opinions that are available. The more information, the more people on the team, the better. And we'll help you navigate what is the right decision for you, because what is the right decision for you might not be the right decision for someone else. So it's really about personalizing it based on not just your health, but your desires, your needs, your goals.
And I would just dovetail off of that and say that, when people are like, well, what's it going to take? We're not trying to sell anybody anything. We're trying to bring reason and experience to help people solve their problems, and people are going to engage at different levels. And so what we really want to do is, be a resource for people, and if we can provide, meaningful treatment, great. If we can't, if we need to refer you to somebody else, we will. And so it's a little hard to say, well, like what kind of commitment does it take? We both make it really accessible to have a basic consultation, and then we offer the people the opportunity. Do you want to schedule a longer visit so we can dig deeper into your health? When we look and see what we find, then we can sort of say, well, let's try this. Are you interested in trying this? And so I think it's just really, I just really want to emphasize that we want to be a resource for people, and we want to help people improve their health systematically, and they need to know that they're getting better along the way.
Well, thank you both. I think that probably gets to most of the questions we're going to be able to get to today. Certainly will, as I said, you can answer that survey as a follow-up if you'd like somebody to give you a ring and you'd like to engage further and ask some more questions. We can certainly help answer them there, and encourage you to reach out via the phone or the email that you see on your screen. Thank you, Tressa and Alistair, so much for sharing all that today. And with that, we'll go ahead and wrap things up.
Yeah, thanks everyone so much for attending. We'll be doing more webinars in the future, so stay tuned. Thanks, Eric. And thanks, Alistair. It's our first one. There'll be many more.
Bye-bye.
Bye.
Bye. Thanks so much.